Tips on how to support a student with Prader-Willi syndrome in your classroom. This information is for secondary schools who have a student with Prader-Willi syndrome or who have offered a placement to an individual with PWS. It is a complex syndrome with a wide spectrum of effect, and you'll need to make significant adjustments to differentiate your teaching. However, with the right care and environment, as for all individuals, those with PWS can really thrive and develop their potential, and it can be very rewarding working with our individuals. PWS is a genetic disorder of chromosome 15. We know that several genes are involved, and researchers are getting close to identifying which genes are the actual cause of PWS. It's a lifelong and life-limiting condition with no known cure or treatment, and is a relatively rare disorder estimated to affect about 2,000 people in the UK. In 95% of cases, it is a random accident of birth and not inherited. The syndrome occurs when there's either a deletion of part of the paternal chromosome, which is the most common cause, or by disomy, the child receiving two chromosome 15s from the mother, resulting in vital information from the father's chromosome not being expressed. There's also a much rarer inherited type. Researchers are beginning to identify differences between the deletion and disomy types, but both types feature the defining characteristics of PWS. For further information about genetics in PWS, visit our website at www.pwsa.co.uk. Whilst Prader-Willi syndrome brings many challenges, most people with PWS have many positive traits, as well as all the inherited and cultural traits of any human being. It can be easy to concentrate so much on the challenges of PWS that the positives become overlooked. If you differentiate your teaching appropriately and create a PWS-safe environment within the school, you'll find that you have a caring, humorous and happy addition to your class, with PWS being only a small part of who they are as individuals. Prader-Willi syndrome has some very distinctive characteristics which define the syndrome. Many of these are caused by a dysfunction in the hypothalamus, a region of the brain which includes the pituitary gland and is responsible for the production of many of the body's essential hormones. However, not all of these characteristics will apply to every individual with PWS. Hypotonia can affect physical development, delaying both fine and gross motor skills and speech. The low muscle tone continues throughout life. Hyperphagia, or excessive appetite, is one of the more difficult aspects of the syndrome. Your student will be increasingly interested in food and have a chronic, unrelenting appetite caused by messages from the stomach not reaching the brain. The range of intellectual ability in PWS is wide. While most have a mild to moderate learning disability, some have no learning disability at all, and a few have more severe learning disabilities. Immature social and emotional development generally becomes more evident once the student reaches secondary school age, but a lack of social skills and communication difficulties can be seen in primary age. There is a distinct set of behavioural characteristics which tend to go alongside PWS, and many individuals display autistic traits. However, it is important to remember that these behaviours are not learned and are a form of communication. Hypogonadism is usually obvious in boys from an early age, as they generally have smaller genitalia and undescended testes. It is present in girls but not so physically evident, and extremely rare for people with PWS to have or father children. Your student may also have very sticky or viscous saliva, which is evident in crusting at the side of the mouth. This can impact on the ability to chew and swallow, and also on speech. Some pupils may have an additional disorder and its accompanying behavioural challenges. These include, but are not limited to, autistic spectrum disorder, attention deficit disorder, dyspraxia and speech and language disorders. If your pupil has a dual diagnosis, you will need to factor in the needs of that disorder as well as the needs of PWS. Low muscle tone will mean that a student with PWS is likely to have greater difficulty moving around the classroom and the school, and a risk assessment is usually required. They may be more unsteady when standing or walking, slower to move around the school, and less able to walk long distances. You'll need to take this into account and allow extra time for your student with PWS to get to other classrooms. Look at whether help will be needed carrying bags and how they're able to cope with steps and stairs. Most students with PWS will require differentiation during PE or other physical activities and very clear, simple instructions. This should be discussed with parents and their occupational therapist and should be addressed within their EHC plan. Physical activity is incredibly important for those with PWS to maintain a healthy weight, build muscle tone, and form the habits that will keep them healthy later in life. Every effort should be made to engage the student with PE, even though they may find this difficult. You'll need to be aware of additional trip or fall hazards within the classroom and around the school, in particular, jostling from other students and bumping into each other. Safety within outside areas needs to address the likelihood of being knocked over or bumped into without affecting their ability to socialise and join in with peers. There can be a range of speech and language difficulties affecting both expressive and receptive speech. This means that some individuals will have a greater level of understanding than their speech would indicate. However, others may be quite articulate, but their comprehension levels are low, so be sure to check that information has been processed and understood. Various speech and language problems have been diagnosed in those with PWS. A speech and language therapist may still be working with the student, and this can be checked in the EHC plan. Sessions that focus on feelings and emotional language in particular can make a huge difference. Visual prompts can sometimes be helpful in easing frustration and aiding communication. The excessive appetite in children with PWS can be a relentless, overwhelming hunger, and your pupil will display this. In some children it appears much later or to a lesser degree, so it's important to check with the parents. It is imperative to establish good communications with parents to ensure that measures are put in place when and if the pupil displays the desire to eat. Additionally, individuals with PWS have no feeling of being full, so the appetite is never relieved and they will not instinctively know when to stop eating. Unmonitored, they could continue to eat and food binge, leading to morbid obesity. Those with PWS also require far less calories than others and must follow a very healthy, low-calorie diet which will be guided by their dietitian or other medical consultant. Your pupil's weight will be monitored closely and the diet adjusted as required. Weight can be gained very quickly and easily. It is essential that the pupil's dietary guidelines are followed precisely and that everyone working with them respects and applies the measures in place. There is to be no deviation from this, and absolutely no food should be offered to your pupil with PWS without the prior agreement of the parents or carer. Even if your pupil claims to have missed breakfast, always check with the parents first. One weak link can undo everything that everyone else is trying to do and will send mixed messages to the pupil which can be very confusing to them. The excessive appetite associated with PWS means that your pupil may food seek, food steal and become very anxious and agitated if they're thinking about or fixating on food. It's really important to control the environment around your pupil to enable them to thrive. All food must be kept out of sight as much as possible, and it's advisable not to keep snacks in your handbag, briefcase or desk drawer. Never allow your pupil with PWS to be unsupervised around food. If you reduce the temptation, you reduce the levels of anxiety, enabling them to focus more on learning. They'll need to be accompanied when walking to other parts of the school, particularly when changing lessons, to reduce opportunities to access additional food. If food is provided, be mindful of how easy it may be for your pupil with PWS to take food from someone else's plate. They'll need one-to-one supervision during lunchtime to avoid this, and food plates once finished with should be cleared away promptly. You'll also need to review access to food bins and any food outlets, including those within the vicinity of the school. When teaching food technology, ensure that healthy options are used and encourage your pupil to make healthy choices. There's no reason for them not to take part as long as they're supervised, and it's always best to send the pupil home with what they've made. This enables parents to work out calorie content and have a very clear picture of what's being consumed. What happens on school trips? You'll need to ensure that if there are refreshments, these can fit within your pupil's usual diet. Once again, it's essential to liaise with parents about the regime they would like you to put in place in these circumstances. Often, with pre-planning with the parents, it may be possible to give extra treats if your pupil's aware that they may have a little less to eat when they get home. Some individuals with PWS have been known to eat non-edible items, and it's important to be aware of this in lessons such as art and science. It's advisable for pupils with PWS not to carry cash. This will reduce the temptation to use vending machines and such, although there's always the possibility that another pupil will buy it for them. It's not unusual for pupils with PWS to be escorted by support staff when in the canteen, and staff should be aware of what they are and are not allowed. If the pupil has school dinners rather than prepared food from home, it's always really helpful to provide a picture of portion size and to keep parents informed of all food eaten. Always remember, even if your pupil doesn't actively seek food, it doesn't mean they won't if given the opportunity. It's always advisable to put these measures in place even if your pupil is not yet showing food-seeking behaviours. There is a wide range of ability in PWS. Although the majority of children with the syndrome have mild to moderate learning disabilities, a significant minority have cognitive abilities approaching average and beyond. At the other end of the spectrum, some may have severe learning disabilities. Many have relatively good reading skills by the time they reach the end of their primary schooling, but they may still struggle with mathematics, and in common with many other young children, those with PWS benefit hugely from visual reminders and prompts about activities. Processing information may be a little slower than in others, and they may need extra time to understand what you've said, or you may need to show them. Many are very able and enjoy creative work, although some may show characteristics of autism spectrum disorder, such as wanting to do things in a certain way, repetitive behaviour, or having a lack of social skills. This may be related to immature social and emotional development rather than true autism, but if this is suspected, professional advice should be sought. Individuals with PWS appear more socially and emotionally developed than they are. As their peers mature, those with PWS will tend to retain childish interests and preferences and lack the maturity of individuals the same age. Social time is more difficult and friendships hard to establish and maintain, so enlisting the support of staff will be important. Consider targeted social skills groups around friendships and relationships for your student. Communicating appropriately can be difficult for those with PWS, and the usual ways of communicating with very young children work well. It may be necessary for this to remain in place throughout their school life. Checking that the student really has understood what you say is vital, as they'll often say they've understood whether they have or not. Repetitive questioning, or perseveration, is often a stage which many young children go through, but those with PWS are likely to carry on doing this. Immature social and emotional development will also impact the student's ability to manage difficult situations, and their reaction may be the same as someone much younger. Those with PWS will develop slower than their peers, and this may result in your student finding it difficult to manage. Additionally, this may well lead to them being more susceptible to peer pressure or bullying. Your school should already have an anti-bullying policy in place, and all staff should be aware that recognising bullying may be difficult for the individual with PWS. It's important to remember that all those with PWS will be affected to some degree by immature social and emotional development, regardless of whether or not there is a learning disability. Not all individuals with PWS will display all of these behaviours, and it's important to understand that these behaviours are not learned, and the pupil is not just being naughty. Although it rarely presents as such, behaviour is a form of communication. Those commonly displayed are emotional outbursts and rages, which may occasionally become challenging. Obsessive behaviour. This can be related to people. They can easily become obsessed with one particular person, but it's also related to objects or food. Manipulative behaviour, with some exhibiting storytelling and fabrication. It's important to work closely with parents to ascertain if their child displays these behaviours, and if they do, always check what the pupil is telling you. A rigid method of thinking, often in terms of black and white, means the child with PWS can have difficulty processing instructions or switching attention from one subject to another. Once a fact is learned, it can be difficult for the pupil to unlearn it or to appreciate that it may not always apply. Skin picking is a known behaviour and difficult to control. It can be a result of boredom, anxiety, or just because there's a rough piece of skin or bite. The pupil's unlikely to feel pain from picking, and whilst covering the area helps, it may not stop it. Like most children, those with PWS work well when they can look forward to rewards for completing tasks or improving problematic behaviour. Smiley faces or star charts work well, and being given responsibility for something works well as a reward. Do not use food as a reward under any circumstances, and remember the degree of learning disability does not necessarily relate to the severity of challenging behaviour. Almost every child with PWS presents with behaviours which can bring challenges to either themselves, those around them, or both. However, this varies considerably between individuals, and it's important to remember that these behaviours are part of the syndrome and have clear underlying causes. Feelings brought about by unrelenting hunger can be distressing and lead to behaviour changes. Many children and young adults also have specific emotional and learning disabilities which can impact on behaviour. These may be evident even where the pupil is functioning at a relatively high intellectual level, and includes difficulties in processing spoken information, as well as speech and language disorders, which can be frustrating for both the pupil and the listener. Individuals with PWS can go from happiness to anger or sadness in a very short time period, and this can be triggered by relatively trivial events such as a change in temperature, an increase in noise levels, or a change to their diet or meal routine. Other factors include a chaotic environment, conflicts of opinion amongst those working with the pupil, and negative attitudes or hostility, whether hidden or obvious, on the part of the staff. Your pupil will be very sensitive to tones of voice and body language. Tiredness can be an issue for your pupil, and they may work better if a daytime nap is built into their timetable. A quiet corner works well if this is needed. Almost all of these behavioural issues are caused by the dysfunction in the hypothalamus, not by the pupil themselves. It is sometimes possible to prevent an imminent outburst, especially if you have a good knowledge of your pupil's triggers or how their body language may change when it's about to occur. The attitudes of other people are also very important, and likely to have a negative effect on a pupil with PWS are aggressive attitudes or tones of voice, a confrontational approach, being overly sympathetic. This can be perceived as a reward. Displaying a dislike for the pupil or trying to talk to them too much. Being in conflict with another member of staff. This is particularly important when it comes to rules and expectations. Using negative language as a means of trying to stop the pupil from doing something. The following are likely to have a positive effect for pupils with PWS. A firm but caring attitude, Staff's ability to keep a sense of humour. Although this can be difficult when confronted with challenging behaviour, it makes a huge difference. The ability to give clear guidelines and boundaries, and most importantly, be able to stick to them. Praise and stressing the positive aspects of the pupil, visual charts work well. And using positive language as a way of showing the pupil how to do something correctly. Make sure that you have a plan in place for what to do if an outburst occurs, and that all staff are aware and consistent in using it. The following guidelines are recommended. Remove the pupil or the audience from the situation if necessary. Take action to ensure their safety and the safety of others. Stay very calm, talk softly and as little as possible. Avoid eye contact. If possible, bring someone else in to take over if you're the object of the outburst. Do not attempt to reason or argue, even if the child is undoubtedly in the wrong. This will only prolong the outburst and cause it to increase. Although difficult, do not give in to their demands. If you do, they may learn that outbursts will get them what they want. Try distraction and humour again, and do your best to ignore the behaviour associated with the outburst. Allow your pupil to calm down in a quiet area and talk about it later in the day. However, do not expect them to be able to tell you exactly what caused the outburst. Children with PWS can become easily fixated on one member of staff, so if at all possible, use several different people to work with them at different times, and ensure your pupil knows you'll be doing this in advance. This strategy works well if one of the staff are unexpectedly sick or on holiday. Try to channel your pupil's behaviour into learning opportunities, such as for a subject that they may find challenging. Support the pupil as much as possible to move on to the next activity by implementing strategies used for those with autism. Due to the nature of PWS, difficulty in adapting to changes in routine can be a problem. However, the following strategies may help when these situations arise. Try to preempt likely changes where possible and prepare your pupil in advance. If there is a need to move to different classrooms, this is going to prove challenging and confusing for your pupil with PWS. It's important to ensure that appropriate support is in place, and this can be provided by a member of staff or by utilising a buddy system. Time prompts may also help with the transition from room to room, such as a timer counting down to the end of the lesson. This will give the pupil time to prepare and think about what they need to do. Visual prompts may also be useful, particularly for navigating around school. A simple map of the school showing clear pathways to each classroom can help ease anxiety, and the use of photographs may ease confusion. Many individuals with PWS have achieved GCSEs and beyond, and this has been achieved with appropriate support in place. It's important to consider the following as your pupil approaches their exams to ensure that they receive the support they require to meet their needs. There may be a need to use differentiated assessment procedures, such as a portfolio of work. Extended exam times may be necessary to enable the pupil adequate time to process information. Exam instructions may need to be clearly and simply explained to the pupil by a member of staff. Visual prompts may also be useful in helping explain instructions and time restrictions. Every effort should be made to ensure your pupil with PWS is given the same opportunities as those that do not have disabilities. Be aware, though, that if your pupil is feeling under pressure, they may display challenging behaviours. Individuals with PWS usually have incomplete sexual development. Males may have had surgery for undescended testes, and both males and females may not enter puberty. It may be necessary during PWSA lessons to include the fact that some people start puberty very early or very late, some do not enter puberty without receiving hormone therapy, and not everyone is able to have children. It's also important to be aware that when coupled with immature emotional and social development, immature sexual development may lead to inappropriate behaviour, but with very limited understanding of why it may be inappropriate. As with any other young adult, your pupil may develop an interest in having a relationship and will need support around this. We're currently working on a video entitled Growing Up with PWS, and our hope is that it will be a helpful resource for individuals with PWS to understand their feelings and emotions. It is vital that this information is passed to the school nurse or medical team and that all staff within the school setting are aware of the following risks. Many individuals with PWS have a high pain threshold and will not register pain. It's therefore very important that they're checked over thoroughly if they've had a fall, and if any problems are suspected, your pupil must be taken to the GP or A&E. Some children may also suffer diarrhea or constipation without complaining of pain. A common feature in PWS is the lack of vomiting reflex, caused by poor muscle tone, and this can mask the fact that they're seriously ill. It's important to find out from the parents if your pupil has a history of having vomited before, and if they vomit whilst in your care, you must inform the parents immediately. Some individuals have a base body temperature that's slightly lower than normal. It's important to know what your pupil's usual body temperature is and have a record of this. If it's usually lower than normal, a rise in temperature to slightly above average is equivalent to a high temperature in another child. Your pupil may also have difficulties in distinguishing if they're too hot or too cold. Easy bruising is another common feature of PWS. Due to the high pain threshold, your pupil may not be able to say how the bruise happened, and this is another reason to keep a record of any falls or bumps. As all those with PWS are different, check with parents about these risk features, and you can find a list of these and other risk factors on the PWSA UK website. All children with PWS will have variable abilities, and it's important to gain as much information as possible from the parents of your pupil before they attend your school. These include: does your pupil have any difficulties with fine motor skills? Are they able to grasp writing equipment? Information about diet and the dietary regime, including exactly what your pupil is allowed for snacks and lunch. The more information you have about their diet, the better. Are there any additional physical difficulties such as scoliosis, a curvature of the spine, or difficulties related to vision and hearing? Difficult behaviour can often be triggered by certain words or actions. Parents will know what these are and can tell you what to avoid. It's useful to know how frequent hospital appointments are and to be aware of how this will affect attendance. How do parents feel PWS affects their child? Information in this presentation is a general overview, and the symptoms of PWS can vary considerably. Therefore, it's important to gain insight from parents as to how much they think their child is affected. It is vital to be familiar with the contents of the EHC plan. PWSA UK is the only charity within the UK supporting those affected by PWS. Please help us to continue and educate your class about PWS by holding a Purple and Pink Day fundraiser. Our easy-to-use pack provides all the tools you'll need to hold this easy and fun event, whilst also teaching some basic facts about healthy eating and Prader-Willi syndrome. The information can be downloaded directly from our website, or you can call our office on 01 332 365 676. We hope you found this presentation useful, and we welcome your feedback if you feel it could be improved in any way. For more information, visit our website or contact us. We'll be pleased to help answer individual inquiries, and we also facilitate a teachers' network consisting of an email circulation list for teachers of pupils of all ages to ask questions and to share experiences and good practice.